In polarity analysis, we mainly use modalities and polar symptoms for remedy determination. And the basis of this technique is that Hahnemann says in aphorism 133 of the Organon that modalities are the most characteristic symptoms of a patient. So he doesn't say the mind symptoms are the most characteristic, he says the modalities. And polar symptoms, what are polar symptoms, are usually also modalities in most cases. Some are not, like thirst, thirstlessness. Polar symptoms are symptoms that have an opposite. Cold aggravates, cold ameliorates. Fresh air aggravates, fresh air ameliorates. Uncovering aggravates, covering ameliorates. These are polar symptoms. And these polar symptoms can be of great use in determining an exact remedy for a patient. Now, how do we get polar symptoms? We have created a checklist of reliable symptoms. You can download this checklist from our website. It is also a part of our software, and this software is actually freely available for people outside of Western Europe and Northern America. It doesn't cost you anything. You can use it. It's very practical. It's an easy way to find the right remedy. And on this checklist, you have 160 polar symptoms and modalities. And it is these 160 symptoms who, in my experience, have proved to be the most reliable symptoms for remedy determination. So actually, you can give the checklist to the parents and tell them to observe the child and underline what they have observed. In general, we need between 8 and 16 symptoms for a remedy determination. In babies, we mostly get rather not more than 8. Of course, in grown-up children or adults, it is different. But the people have to learn to observe these modalities. What do you do if you don't get enough symptoms? You must search for basic modalities. Basic modalities are the position of the child. Is a baby better when lying or when sitting or standing for an older one? Is it better in a cool environment, in a warm environment? Is it better when you cover it or when you uncover it? How is it with open air, with movement, exercise, appetite, thirst, cold or warm food, drink? So these are very helpful. And it's only these few modalities, polar modalities, can already decide which remedy a baby needs or a small child. So we come to the first pathologic condition, that is baby colics, most frequent. The pathogenesis of baby colics is inefficient drinking or suckling. Most children with baby colics drink too voraciously. Some drink too slow, maybe because they have a blocked nose. A blocked nose means a baby cannot properly drink because they cannot breathe. So they swallow, and then they have to open their mouth to get some air and then swallow again. And so they swallow also air. And that makes them gulping air. They're quickly full because the distension of the stomach makes the feeling of satiation. but they are soon hungry again. And as the air is transported on in the intestine, it produces the flatulent colics. So imagine you have a newborn child. After 2-3 weeks, this child is only crying constantly, hours, and it seems to suffer. And you are an unexperienced parent, and you have looked forward so much to your baby, and now this baby just cries and is unhappy. It's a terrible situation for the parents that needs desperately to be relieved. So I show you how we do that. We have a 4-week-old girl, Ariane, that cries for hours, kicking and stretching her body backwards. In the medical language, we call that opistotonus. When suckling, she drinks voraciously, frequently choking. She has difficulties to burp, is quickly full, but an hour later again hungry. On the examination, the child is irritable, has a slightly elevated muscle tone, and a distended meteoristic abdomen, a lot of air in the abdomen. The weight is normal, the child has no other symptoms. So it is not seriously ill, but it is really handicapped by these flatulent colics. Normally, in practice, I just ask the parents through the symptoms, or if they don't have any, I tell them, please take the checklist and you observe what you can. So here we have the symptoms of this little girl. Painful flatulence, it's worse after drinking. That is a frequent symptom. It is worse when lying, better when stretching limbs, better when burping, better after breaking wind, better after school, and she is very hungry. So you see very few symptoms. P marks a polar symptom. So we have 1, 2, 3, 4, 5, 6 polar symptoms. That is not really much, but it may be enough to determine the remedy. So we just enter all these symptoms into our repertory. And now I explain you what is the outcome of this repertory. We have up here the remedies that are covered, that cover the symptoms, the number of symptoms hit, and the first line, sum of grades, second line, and the polarity difference, third line. This polarity difference is actually our key information about which remedy is best for the child. And it is calculated by adding all the polar patient symptoms. You have here below the blue line and above the red line, we have all the patient symptoms. And we add all the grades of the polar patient symptoms, only the polar ones. The non-polar ones are left away. So this makes here 5, 10, 15. And then we subtract the grades of the opposite symptoms. Down here, below the red line, you have the opposite symptoms to the symptoms the patient displays. So after drinking worse, the opposite is after drinking better. Lying position worse, opposite lying position better. Stretching out affecting limb better, worse, etc. And now we add the grades of the polar symptoms, polar opposite symptoms, and we subtract them from the polar patient symptoms. So this is 15 minus 4, that makes this 11. In other words, every grade up here is an argument for this remedy in favor of the patient. And every grade down here is an argument against this remedy in this patient, because here the opposite is the case. This is the patient symptoms, the opposite. So we get a measure of how actually of the probability of healing for each remedy. You see here, for instance, kalium carbonicum. It has a polarity difference of 1, and that means we have most arguments here are against. The weight of arguments against this remedy is big, or in chamomile it is even 0. So it means it is, even though chamomile covers nearly all the symptoms of the patient, one is missing here, but even though it covers nearly all the symptoms, it is totally non-specific for this symptomatology. While we have here antimonium tartaricum, that covers everything that we entered, and that has a good specificity for the symptoms. Aurum has also a good specificity, but there is one symptom missing. Pulsatilla is already less perfect for this patient. Also a symptom missing. So our choice actually is, in this case, antimonium tartaricum. There is another idea I have to explain to you. That is Bönninghausen's concept of contraindications. Bönninghausen strived to cover the symptoms of the patients with genius symptoms. Genius symptoms are very typical symptoms with a grade of 3, 4, or 5. While non-genius symptoms are incidental observations in the provings, and they have a low grade. Here we have, for instance, hunger in Ignatia as 2nd grade, so it's an incidental observation. But we have appetite absent in Ignatia, which is a genius symptom. It's a typical symptom for Ignatia. It has been frequently observed in the provings. And Bönninghausen found that if you have this constellation, low grade patient symptom, high grade opposite symptom, this is a contraindication to give this remedy in the patient, because it doesn't cover everything with which is typical for the remedy and for the patient. In our software, we have these gray shaded columns, and gray shaded means they contain contraindications. We mark them with CI here, and you see every column here has contraindications. So these are the remedies that are much less probable to heal a patient. So actually we can focus on the white remedies and focus also on the highest polarity difference. So that's actually already all. Okay, antimonium tartaricum first choice, aurum would be second, pulsatilla third choice. If you make a materia medica comparison for antimonium tartaricum with the guiding symptoms of hearing, we find in antimonium, abdomen tympanitic, very sensitive to pressure, worse after warm drinks, especially milk, very typical in a baby. Violent colic, worse sitting bent over. Colic around umbilicus, better after school, after stool, and belching reliefs. So we actually have all the key elements of the symptoms, modalities. So I give her antimonium tartaricum C200, one dose, and she starts immediately suckling more calmly, and the flatulent colics disappear completely within 2 days. So that's the easy way out, you see. It's not always that easy because often we have difficulties to find good symptoms in these small babies. So actually what I always do, I give the baby the first remedy, in this case antimonium tartaricum, and I give also 2 reserve remedies to the parents, in this case aurum and pulsatilla. And I tell them if the child does not improve within 4 days, you give the second remedy. You would give aurum. And if aurum doesn't give a relief within another 4 days, you give the third pulsatilla. If that doesn't function, come back to the clinic. Sometimes we need two attempts because the experience, the knowledge of the parents within the first few weeks of lives with their babies is rapidly increasing. So this is really impressive how both baby and parents get adapted to each other in this first phase of life.